Today we have a right radial artery. First, we're going to start with our anterior dissection and sequential anterior fasciotomy. I like to slip the blue blade under the anterior fascia and activate the bipolar cautery while lifting upwards and advancing forward to cut through the fascia. If we encounter some side branches, we can take those as we go. Here I'm continuing up the forearm. You can see once you get about halfway up the forearm, the space typically opens up a bit, but I still continue the anterior fasciotomy all the way up. Here's a little arterial branch to the 3 o'clock position. And the 1 o'clock position, you see how I rotate the blades up to 1 o'clock. I don't steer the camera to move the blades into position. You always want to rotate to the branch. Continue with our conical tip dissection. Here I'm going to finish up that anterior fasciotomy. Even though we have enough space here, I like to do a complete anterior fasciotomy just to prevent any compartment syndrome in the postoperative period. Here I'm going to take another medial branch. I find with the tiny radial branches, you don't have to rotate quite as much as you do with bigger vein branches. See here, I'll sneak the green blade under the lateral branch. Continuing the dissection up the lateral side. Here I freed up a small kind of posterior lateral branch, sneak the green tip in, activate the bipolar, a slight tapping motion, and forward to cut the branch. We're going to repeat this process all the way up the lateral side. See the posterior fascia behind the radial pedicle. For those of you that don't do a lot of radials or haven't in the past, you can tell that fascia by the transverse bands. There's a nice little branch. The Venapax cuts these just effortlessly. There's a nice little branch. Rotate the blades down to about 7 o'clock. Capture the branch between the blades, and you barely see a little puff of white water vapor as it activates. You don't get all the charring and the smoke that you see with some of the other systems. Here you can see that lateral vein on the pedicle, and I'm just going to gap that tissue down the lateral side between my two blades, activate the bipolar, and advance down the tunnel. I keep my eye on that lateral vein the whole time, so I ensure that I'm not going to burn that lateral vein or get anywhere near the radial. Now I'm going back to the medial side, trying to separate it away from that posterior fascia. This I'm cutting here is actually a little bit of the posterior fascia, trying to make some space to get into that branch that's just past it. So once again, this is a right arm, so I don't have to worry about the nerve on this medial side. If you can't get that posterior fascia off the branch, you can just cut the whole thing. There's times I'll just divide sections of that posterior fascia, like right here. Here I'm trying to sneak in there so I don't have to take the fascia the whole way. But it's kind of stuck in this one little section. So you can see if I use that blue sharp blade, kind of hook it under on the medial side there, activate my polar, and I'm kind of rotating counterclockwise as I move forward to run that sharp blue edge. Acts as a knife as it's cutting and sealing any branches in that section. See how I use the tip to manipulate the radial pedicle away from where my cutting blades are going to be. I'm just going to clean up some of that posterior fascia. There's a little posterior, looks like a venous branch. There's another small arterial branch. This is all under continuous CO2 insufflation. I use a flow of 3 to 5 liters per minute, pressure of 10 to 12 millimeters of mercury. Getting close to the end here. Make sure you don't get that muscle to the right. Another small branch. I do these under tourniquet. I think my tourniquet time is about 15 minutes in this case. I don't start it until I actually put the scope in. I do a fair amount of dissection initially at the wrist. I start my incision about a finger breadth below the wrist crease. And I use a tenotomy scissor and some gerils to manually free up the beginning part of the radial pedicle. A little technical difficulty there. My light cord popped off. All right, now I'm just checking to make sure I didn't miss any branches. I use a tip to kind of roll things over one way and then the other. Kind of reveals any branches that you might have missed along the way. This last little bit of connective tissue up top. Here we're up in the antecubital fossa. You can see me palpating externally. A little stab. Typically use a mosquito on these. You don't want to get too greedy with the radial. You'll get into this large confluence of veins. Here's my stab and grab. Once I get around the pedicle, I now push the skin down to the radial, and I typically take out my CO2 insufflation at this point. So I bring the skin down to the pedicle and I don't try to yank the pedicle up. Here I'm just cutting across the pedicle externally. I'm going to use my blades to grab the tip of the pedicle. Try to just grab the edge, some of the fat there. And you can see as I pull it back, I'll watch and make sure I didn't miss anything. All right, that's the end of our right radial artery harvest using the Saphena Medical Venapax System.